Hello and welcome to the online demonstration of MYEPCR. We will take you through the application using the following fictitious information. Sarah Thomas, aged 52, was at an outdoor cinema event when she tripped and fell over and injured her leg. Event stewards have radioed to the medic control requesting assistance. Jane, a paramedic, and Tom, an emergency care assistant, has been dispatched to the incident. On the home screen, there are several options depending on the situation. The full PCR is used for more serious injuries and medical emergencies. The minor injuries form is used in non-emergency situations, and our medication issue forms allow you to quickly give simple medication such as paracetamol without the need for a full form. Also included are other useful applications we will show you as we go through the demonstration. Tom has chosen to use a full PCR form based on the information received from the control room. He enters the call information received into the call details section of the app. They enter the date and time of the call, PIN, role, and vehicle information. It is Saturday 25th of March 2022 at 8:30 p.m. when the call is assigned. They arrive on the scene and immediately start assessing the patient. They start by gathering Sarah's details: name, gender, date of birth, age, which is now automatically calculated from the date of birth, address, next of kin, and doctor's surgery information. Here we can also add the patient's email address should they wish to receive a copy of the PCR. All information entered here and through the entire application is stored securely and encrypted. Our data security is compliant with NHS data storage regulations and governance. Tom completes the primary survey on Sarah as Jane documents the findings in the app. Tom then takes a full set of observations, and as he gets the results, they are quickly captured on screen. By adding the respiratory rate, blood oxygen level, blood pressure, pulse rate, AFPU, and temperature measurement, the app will quickly calculate the patient's NEWS2 score and display the score on the screen. A visual warning is shown on the screen of Sarah's NEWS2 score. All other observations including peak flow, pain score, capillary refill time, blood glucose, pupil reactions, and sizes are all captured quickly within the app. When taking Sarah's blood pressure, Tom feels it looks high but cannot remember the stages of hypertension, so he uses the guide built into MYEPCR. This saves time and also allows Tom to maintain his professionalism without asking Jane for advice. Visual guides for temperature, NEWS2 score, pain, pupil sizes, and GCS are all available at a touch of a button. By completing the GCS calculator responses, the GCS score is automatically calculated and shown on screen. Moving on to the narrative, Tom selects the type of call they are attending, which allows for the relative prompts to be shown. There are choices here for trauma, medical, and road traffic collisions. Each selection displays different prompts to capture the information required. Included in the narrative, there are lots of on-screen prompts to aid the medics in capturing all the information required. Jane enters all the information into the relevant sections whilst Tom prepares to give Sarah some paracetamol and Entonox for pain relief. As part of the drug's history, Sarah discloses she is on labetalol but cannot recall what the medication is used for. MYEPCR contains over 1,000 common NHS medications which are easily searchable on screen. Also included here is the drug search tool, which takes you BFN Guidelines website. Simply enter the drug name, select and click Lookup. This search is specific for adults and children based on the personal details entered earlier and will take you to the relevant guidelines. Sarah also mentions she is allergic to penicillin, which is noted in the known allergies section. Tom provides Sarah with the paracetamol and Entonox and then adds this to the medication section of the app. The known allergies entered earlier are shown as a warning on the medication screen to ensure only the right medication is given. Jane enters the information as required, documenting the route, batch numbers, expiry date, and dosage for the medication. With the search function, finding medication is simple. Included in the medication section, you can view the BNF NICE guidelines for the drugs being given. When the drug is entered, you will be taken to the relevant page for the age of the patient. All drugs must be given within the medic's scope of practice. As Sarah has high blood pressure and she is on medication, Jane asks Tom to set up a 12-lead ECG to monitor her heart. The dedicated ECG section of MYEPCR allows Tom and Jane to capture the information. The ECG section documents any findings, including rhythm and any ST elevation. It also allows the medic to capture and upload a picture of the ECG. Jane goes back to the narrative and adds the findings from the ECG. As a trauma injury, Jane uses the trauma section to document the injury and trauma to Sarah's leg. This includes a diagram where you can annotate onto the body outline where the injuries are. An immobilization plan is also included. The trauma diagram has body outlines for all patients' ages. As they start to treat Sarah's injured leg, they enter all the information into the treatment section on the screen. This allows them to capture everything and then work on a transport plan. Adding further information on various screens is easy with the MYEPCR application, and the home screen is always a click away. As part of the discharge, Tom asks Sarah to sign the treatment given to her today by the medics. The medic has the option to ask the patient to scan a QR code on their phone to sign. This minimizes any cross-contamination to the medic's device. As the local ambulance arrives on scene, Jane provides a full handover and prints a copy of the PCR using the onboard printer. We hope you have found our demonstration of the MYEPCR application useful. There are lots of features included that we did not cover today. These can all be found on our website, www.myepcr.com, under the Our App section. In the coming weeks, we will be offering free 7-day trials of our platform so you can see how it fits into your business requirements. If you are interested or would like further information, please contact us via our website or email trial@mobile-forms.co.uk.